These contact lenses go in your eye. That's an exact science. Fitting contact lenses, making sure that you don't harm the eye in any way, shape, or form. And yet you see people buying these pretty cheap lenses and putting them on. That can't be a good idea. How serious is it? Let's visit this morning with optometrist Dr. Albert Pang back on the show. Dr. Pang, good morning.
Good morning.
Appreciate you being here. I'm guessing you're against this. Am I right?
Yes, of course. I think the consumer, when they're making the decision of buying lenses or unregulated lenses online or other outlets, they're making a big assumption that is they are safe, and then there's nothing will happen when they use those lenses for a short period of time. But nothing contrary to the truth, because basically there's two things happening. All cornea have a different form and shape. We're making an assumption that one size fits all. One type of lenses will fit all cornea. That's a big wrong assumption. And the second is that the lenses can sell to a consumer, they must be safe. And then again, the second thing is they are not safe because we don't know where the source of the lenses, what they're made of, and how good is the manufacturing process. And worse yet, solution that they're soaking in do not know whether they're contaminated or not, and whether the pigment that they use have any toxic material.
Yeah, exactly. On the solution, I mean, even that, anybody who's ever gone through a serious thing with their eyes, not just, I've got, nearsightedness, or you're getting older, you hit 40, whatever. That's one thing. Not everybody goes through at some point differing age. But I'm talking about I've had serious thing with the eye before, and I can't imagine doing anything that would harm, that would, put myself in vision jeopardy just to get the look of it doesn't make any sense to me. But I know, look, everybody's different, and you're given good information on this. How what kind of serious things have you seen come from people putting knockoff or, drugstore contacts in that are costume and they're not part of a prescription? What have you seen?
Been in practice for over 20 years. There's a wide spectrum of complications we see from using those unregulated contact lenses, from simple infection to scratch cornea to corneal ulcer. And, of course, the most serious thing is corneal ulcer. Corneal ulcer is basically like having the cornea have an area that is being dissolving, melting, causing permanent scar after they recover. So they will left a permanent hazy spot in their vision all the time. And those are the most severe or the worst consequences of it.
Yeah, and that's just, that's terrible. And, even if things can be fixed, you're looking at some steep bills here for what would have been like a little bit of dress up. There's a crackdown on this now, apparently. Dr. Pang, nationwide on these costume lenses, and in Texas, San Antonio, convenience and dollar stores where amazingly you could buy these at the convenience store. I'll just get something to put inside my eyes at the convenience. Unbelievable. They had to pay $50,000 in civil penalties and in settlement with the Texas Office of Attorney General. Look, law enforcement is onto this, and they're trying to crack down, apparently.
I think the problem is, let's face it, even the state or federal government just don't have enough manpower to crack down all those. And I think the biggest vendor for this type of unregulated lenses is still the internet. And the consumer can easily go online and get all type of crazy lenses. I think the only thing that we can do is talk to the audience, your audience on the radio, talk to the public to let them know this is not a good idea. And hopefully more education from the consumer side, they will shy away from using this type of unregulated lenses.
Are more fines a way to get at that vendor, or is this a case of, well, look, it's the buyer beware. You're warned this isn't a good idea. We're not going to put them out of business, but you should be warned that if you buy their product, you are going to be putting yourself in harm's way with your vision. What's the best way to approach it in your mind as an optometrist?
Of course, both. But again, for my part, I believe that patients a lot of time consumers just do not realize the risk of it. I think, like the beginning of the interview, I talked about they always have this optimistic feeling that they are safe. I don't care where the sources are those lenses, but they must be safe since they can sell it in the market. And the second thing they really assume is that nothing will happen. Everyone is doing this. I think this is the biggest thoughts that we are thinking when they are thinking this way. Because again, it may be you that is the one that's unfortunate. And the other thing is, we are rolling a die. We are just playing chance. That's all.
Dr. Albert Pang, optometrist, our guest here. Dr. Pang, I appreciate it. I don't know why people would do that. I honestly don't. I mean, I'm the worst. I was, for optometrists like you, to go in to fit me with contact lenses, I'm the worst patient in the world. I hate having stuff put in my eyes. I'm just, they're trying to, we're going to get more solution here. We're going to make it smooth. No, you're not. I just couldn't imagine walking in off the street and grabbing this or going online and getting it and saying, oh, these are perfect for my eyes. And a hard time doing it with an experienced professional doctor present, let alone the other. Good information overall. Thanks for being with us here on this Halloween morning. Appreciate it very much.